So at first position the patient in supine position, that is head first supine, and for MRI neck use head neck coil. You can see that at the left side there is the bottom part of the head neck coil, and on the right side there is also the upper part is adjusted to the lower part. So this is the head neck coil and used like this. And let's go to the console and first register the patient. So enter patient name, then patient ID, and then height and weight of the patient, and then patient position head first supine, and then click exam. You can also give referring physician, and then from the exam select from the list neck, and then click exam, and then from the routine folder drag the protocols to the exam card. So right now the localizer, the first scan is running and it's preparing for scan, and it's scanning the localizer for neck. And here I got the localizer 3 images, sagittal, coronal and axial. Now I am planning for the first protocol, that is T2 team sagittal or STR sagittal. So for this I have select the field of view 230 and planning on the coronal and axial images, and plan the slice so that the slice is parallel to the spine, and then click apply. Now I am planning for coronal image, starting by T2 team coronal. I have increased the field of view to 350, and also the field of face I am increasing. For T2 coronal I am just copying the planning from the T2 team coronal and then click apply. And for T1 coronal I am again copying the planning from the T2 team coronal, and I have reduced the field of view to 250 and increased the field of face. I am checking all the coronal protocols, and here I am reducing the field of view to 250 and increasing the field of face to 75. And now I am planning T2 team transverse. For this I have to plan on the sagittal and coronal image. I am reducing the thickness to 4. Slice thickness is 4. In the meantime, the T2 team sagittal scan have been completed, and these are the images of team sagittal. and the problem is that the patient have lesion on the base of the tongue, so I have to include the slice, cover the slice from the base of the skull to the root of the neck and the upper chest. So on the axial protocol, you have to maintain the covering from the base of the skull to the upper chest, and also focus on the root base of the tongue because there is a lesion of the patient base of the tongue, and the slice thickness is 4 and number of slice is 30. I am checking again, and click apply after the planning is complete. And for the other axial protocols, just copy the planning, slice and saturation and click apply. And now T2 transverse open, and I'm copying the planning from T2 transverse fat set that I planned before, and then click apply. And for T1 transverse, copying the planning from T2 transverse, slice and saturation and click apply. So these are the pre-contrast protocols for neck that I have planned, and scan will be happen one by one. So it's time to check the images and printing. So first of all, this is the my first protocol that I have taken for neck. This is T2 STR sagittal, and this is T2 STR coronal, or T2 team coronal for Siemens. And you can see that there is a large lesion in the right side of the neck. I'm checking the sagittal image again, and also there is a lesion in the base of the tongue, and also there is a lesion in the right side of the neck, in the huge lesion. So this is the team sagittal, and I have to measure the lesion by using the scale, and this is 5.4 centimeter in length, and I have to measure the width of this lesion, and that is 3.7 centimeter. So if you find any lesion, try to give the measurement, and it will be very helpful for radiologists and doctors. And now select the series and send it to the filming to print, and in the filming they change the layout to 5 into 5 so that 25 neck sagittal image is fitted in the film. So this is my first film that I have prepared for printing. You can see the lesion in the right side of the neck, a fairly large lesion. And this is a T2 team coronal, and this is the fat set sequence, and you can see the lesion involving the tongue and the neck. I am also measuring the lesion here in the coronal image, and the length is 4.8 centimeter and the width is 3 centimeter. And now select the series and copy to film sheet and go to filming and select folder, and there is two film because the image number is 25, I think. So I have to change the layout of the film from the layout option 5 into 5, and that means 25 image will be fit in the film. And I have to delete extra 5 images because there was 30 image in the series, and I have deleted 5 image and to make one film. So I am deleting from the front and the back, and zoom in the image so that the neck is fit with the lesion. And also provide the reference image in each segment and print out. Now the next series is the T2 coronal. So this is a T2 coronal series that is completed, and next is the T1 coronal, and I am scrolling both the sequence at a time by the use of the keyboard, and you can see that the lesion is mixed signal in the T2 sequence and hypointense in the T1 sequence. So I have select the T2 coronal and send it to the filming, and from the filming again I am changing the layout to 5 into 5, and there is extra 5 images, and I am deleting from the front 3 images and from the back 2 images from the back. And now slightly zoom in the neck image and adjust the window so that the window or contrast is perfect, that is not very so bright and not so dark. So this is the third film that I'm preparing. The first one was T2 team sagittal, second one was T2 team coronal. Now it's T2 just T2 TAC coronal, and TAC means turbo spin echo. And team means turbo inversion recovery magnitude, and it's a STR protocol. That is team, that was team my previous film, but it is a T2 that I am now preparing and print out. This is a T2 team axial. You can see that the lesion is hyperintense in this sequence, and the axial images are taken from the base of the skull to the root of the neck. Here is two images. One is T2 STR and next one is T2 fat set. So you can print any one whether you like. I think T2 fat set is more smooth and looking good. So I am selecting this T2 fat set, not STR, and measuring the lesion in the transverse image. There is also lesion in the base of the tongue. You can see here is the base of the tongue lesion. So select the series and send it to the filming, and also send the reference image and change the layout to 5 into 5. So there is extra images at the back, so I deleted this to make it in one film. And now adjust the zoom of the image so that it perfectly fit in all the segments. So this is the first transverse film that I am preparing, and it's a T2 fat set axial or transverse. You can see that the normal fat set is not suppressing fat homogeneously in all the place. You can see there is fat in the lower part of the neck because this is normal fat set. But if you select the trim or STR, then you will see that there is homogeneous fat suppression in all the place of the neck. And this is T2 transverse, and select the series and send it to the filming, and also send the reference image for the transverse, and delete some images to make it one film. Extra images will be deleted and the reference will be there at the last. And then zoom the image to fit in the segments, and pan the image at the middle and adjust the contrast. You can slightly up some images, slightly drag up, because the lower neck is slightly down from the upper neck, and also adjust the reference images. Adjust the contrast of the image by the mouse, and at least put all the information, patient information in first segment, all the parameters and the patient information like patient name, ID, age, etc. This is the T2 axial that is come, that is appearing here. So select the series and send it to the filming, and also send the reference image and delete some extra images uh, from the behind, and adjust the zoom of the image and also the contrast. So this is the third axial film that I am preparing. First one was T2 team transverse, second was T2 transverse, and then T1 transverse. So all my pre-contrast protocols have been completed. Now I have to check the post-contrast protocols. For this, click this injection tab and set the volume, that how much contrast you will give, and that is 10. And also select the agent name post contrast and then click OK. Now drag the post contrast protocols to the exam list, and from the neck contrast folder select the post contrast protocols, and that is that are T1 sagittal facet, T1 transverse facet and T1 coronal facet. So these three protocols will be taken for post contrast. So always take T1 facet protocols after contrast injection. So now I am planning for T1 sagittal facet, and for planning I am just copy the planning from the previous T2 team sagittal, copying the slice and saturation and just click apply. So no need to plan again, just copy the parameters from previous protocols. So contrast is given and scan has started, and now planning for T1 transverse facet. So planning on the sagittal image for transverse, sagittal and coronal image. You can either copy the plan from the previous transverse protocols or you can plan manually for this. So keep in mind that you have to cover from the base of the skull to the root of the neck and the upper chest. So this is the planning, and I keep press apply, and now T2 coronal facet open, and for this I am just copying the planning from the previous T1 coronal planning. So this was the planning for coronal, and click apply. So all three post contrast protocols have been planned, and now it's time to printing. So this is the first post contrast protocol, that is T1 sagittal facet. You can see, and the lesion, the mass lesion has taken the contrast, enhanced with the contrast, and again I am measuring the tumor by using the measuring scale, and that is 5.4 centimeter in length and 4.4 centimeter in width. So select the series and send it to the filming, and from filming change the layout to 5x5 and drag and adjust the images and zoom, adjust the zoom and also adjust the contrast of the image if you want. So this is the first post contrast film that I am preparing now. I think it's okay, and print out. So now the second post contrast image is T1 transverse facet, and you can see the lesion is enhanced with the contrast, and there is also a cystic part of the lesion. It could be a parotid gland tumor or a lymph node tumor, and measure the tumor by using the scale from the software, and it's a 2.8 centimeter in length and 2.3 centimeter in width in transverse image, and select the series and send it to the filming, and also find the reference image and send it to the filming, and then in filming change the film layout to 5 into 5 so that 25 image fit in the film. And there is one, I have to delete one extra image to feed the reference image, and also adjust the reference image and print out. And the last one is T1 fat set coronal post contrast. You can see that the lesion is enhanced with contrast and there is a cystic part of the lesion. And again measure the tumor with the scale, and in this case it's 4.8 centimeter in length and 3.13 centimeter in width. And also find the reference image and send it to the filming, and in the filming change the layout for coronal is 5.5 5 into 5. Actually I'm using 5 into 5 for all the films in this MRI for neck, and I have to delete extra 5 images to make it in one film. And now it's 25 images. Extra images have been deleted, and adjust the zoom of the image and then print out. So hope you enjoyed the video. Don't forget to subscribe my YouTube channel